sprained your ankle? Most people have at least once in their life. Often people are encouraged to just walk it off, or perhaps they're given the guidelines of RICE, which is an acronym that stands for rest, ice, compression, and elevation. Rest may come in the form of a boot or a brace, or using crutches, or just keeping off your foot. Ice, of course, you might use for about 20 minutes on the hour. Compression would include a stocking or a wrap around the ankle to hopefully minimize or control some of the swelling. And elevation would probably be even more effective if you're able to get your foot up above your heart and let gravity to assist in keeping the swelling down. Most severe sprains can be difficult to differentiate from a broken bone without an x-ray. So if you're unable to bear weight, there's severe swelling or it looks disfigured, definitely seek medical attention and have it x-rayed. Should you not have a break but have the more typical sprain, which accounts for at least 90% of ankle sprains, rather than just using the principles of RICE, which focus primarily on the symptoms that you have, perhaps you might get back to walking and walking pain-free a lot sooner if you were to come in for some treatment. Should you not have a break but have the more typical sprain that at least 90% of our patients have, we can often have you walking without a limp and with much less pain in just 1 to 2 sessions. How do we do it? The force that sprains the ankle seems to lock the ankle up and cause calf muscle guarding. That severely limits ankle dorsiflexion and weight bearing. We use 2 to 3 simple manual therapy techniques to unlock joints around the ankle and to release the trigger point that people have in their medial gastrocnemius muscle. Once you have full range of motion, walking without pain is more effortless and no longer hurts. So it's your choice. You can RICE for a week or you can walk today.